WPTV News Channel 5 Sabira Rayford shows us how they're helping others while trying to avoid burnout themselves.
It was incredibly scary.
Dr. Rachel Needle is one of 1.8 million people in Florida who was diagnosed with COVID-19.
You have to be isolated, which makes it even harder to be, in the hospital. And I definitely went through my stuff where there were times when I would cry.
The licensed psychologist says the time she spent physically recovering was paired with self-reflection.
As a mental health professional, I think of myself also as an advocate. And if I'm not speaking up about issues related to mental health and even being human in doing that, then I'm not staying true to who I am.
Dr. Needle says right now a big issue in the mental health profession is burnout.
We're creating space for our clients to process and work through some of those things that maybe we as well are struggling with.
She and her colleague Amanda Patterson have created an online space called My Private Practice Collective, where more than 16,000 mental health professionals can share resources to fight provider fatigue.
So burnout for therapists is really worrisome because we have to be there, we have to be present, and we have to be clear-headed.
Patterson, a licensed mental health counselor, says her practice has doubled their number of clients. She says setting boundaries is critical.
Creating balance between making sure we're serving our communities, but also referring out when necessary, or hiring, right? Like that's been a big thing we've done.
Dr. Needle says just like her clients, she too practices self-care.
Taking time for ourselves, for our families to regroup and having, I call them self-care days.
Reporting in Palm Beach County, Sabira Rayford, WPTV News Channel 5.